all, we talked about what cancer was, and then we now moved to breast cancer. And we now said that breast cancer occurs more in the females than in the males. But it does occur in the males, but it's like one for every 150 females that suffer cancer, you have a male that's been diagnosed. And then we moved from there to risk factors. We pointed out yesterday that if you have a family history of breast cancer, you might likely come down with it, or it places you at a risk. So you will screen yourself more often than another person who doesn't have family history. We also looked at lifestyle, like smoking, alcohol intake, also makes your risk of contacting breast cancer higher, and then lack of exercise and all of that, like we have always been saying and we continue to say, those predisposes you to breast cancer. Then we also went ahead and looked at prevention yesterday. The only prevention is if you, like we said, the lifestyle that is detrimental to your health, run away from it, and then you will probably reduce your chances. And then if you have a family history of breast cancer, please go for screening, so that even if it does occur, it will be caught early.
Wow.
Yes.
Wow. So we learned, we covered a lot yesterday.
Yes.
And I think there were some questions and we answered those questions. So guys, the questions are very important. If you have any questions, if you have anyone that suffers from breast cancer or feels that they might have something like a lump, is it a lump in the breast?
Yes.
And we talked about different lumps in the breast that you need to look out for. And some of them are cancerous and some of them are not, am I right?
Some of them contain
Good. Right.
Okay, just a minute. So sorry to cut in at this time. I think we might have a little bit of trouble with Dr. Dolly's microphone. It's not coming through early.
Okay. So
Yeah,
just to,
not loud enough.
okay. So what we'll do is we'll just confirm what's going on with Dr. Dolly's microphone.
Hello, can you hear me now?
No.
Okay, so I think something's wrong with the microphone. Okay, what we're going to do, if we can just go off camera for a minute, we'll just double check. Well, I might swap my phone with Dr. Dolly. Yeah?
Okay, great.
Go off camera for a second, please.
Okay, so just to respond to some of your clamor for the audio to be better, I just had to pause the show so that Dr. Dolly's microphone can probably work better. But thank you very much for noticing that and calling it in. We really appreciate that as well. So shortly, we're going to have Dr. Dolly and Mr. Tony back. Just as Dr. Dolly has said, yesterday she actually talked about cancer. And for coming on this show, okay, someone else just said, okay, so I think we probably have various views. Someone said I can hear her, someone said I can't hear her. But just to be sure that everyone can hear, we just want to swap the microphones and ensure that her microphone is working properly as well. Okay, so thank you very much again for staying on at this time. And we believe that because it's a live show, all of these things are actually bound to happen most of the time. And we're going to come back stronger when they come on the set right now. So yesterday, Dr. Dolly focused on cancer, like she has mentioned, and she's going to break it down today for us. Just in case you have someone who you have invited on the show, please, it's time to probably send them the link. And what I'll do is I'll also put the YouTube handle on the chat area so that you could actually just copy that and send it to whoever you're inviting for the show tonight. Yeah, and it's easy for them to come on. And if you're on YouTube with us, please do click on the subscribe button. Now it's free to subscribe, yeah, and also you could click on the notification bell so that you can get us live anytime we're on set, right? Okay, I can see pictures now. I'm just going to test Dr. Dolly's mic. Hi, Dr. Dolly, you want to say a word?
Hi, Marvel, can you hear me?
Fantastic, fantastic. It's just like you're in my room. I can hear you loud and clear. Hi, Mr. Tony.
Okay. Marvel, I just want to say, can you hear me?
Loud and clear. I can hear you loud and clear. Okay, I think we're good. I'm handing back to you guys now in the studio. So over to you for now. Thank you.
Okay, so like I was saying, I was just doing a little summary of what we did yesterday. We talked about, we defined cancer yesterday and talked about breast cancer in particular. And then we went ahead to talk about risk factors for breast cancer. what makes you at risk of coming down with it higher than the general population? One, you have to have a family history of it. Two, some kind of lifestyle that is detrimental to health might actually increase your chances of getting breast cancer, like tobacco smoking and excessive alcohol intake. Another one, we also talked about types of lumps that you can see in the breast. We talked about the fibrous tissue, which is kind of a scar forming on the breast tissue, which can also give you a lump, and then cyst, which is a fluid-filled sac that you can see on the breasts. And today, what we're going to do today is we are continuing with breast cancer, like I said before, and today it is all about the signs and symptoms of breast cancer. What do you need to see in your breast to raise an alarm in your head that something is going on? Now, let's look at it. The first thing you see and you should be worried is a lump in the breasts. Most of the time, it can be benign. Benign means that it's non-cancerous. Most of the time, it might be cancerous. But whenever you see a lump, you must be checked by a doctor. It is very, very necessary. Another one is when you have pain in the armpits, pain in your armpits or breast that doesn't relate to the woman's menstrual period. This is alarming. So you need to be checked out. Another one is pitting or redness of the skin of the breasts. Like it turns the breast like the skin of an orange. It's, you know how the skin of an orange pits, it has small, small pits. That's what you see when a breast is suspected of being cancerous. And when such a thing happens, you fly off for examination by medical personnel. Another one is instead of you now seeing a lump or swelling in the breast, you see it in the armpits. It is still part of it. Another one is a thickened area of tissue in the breasts. It is not a lump now, but it's thickened. That is very suspicious. One of them is that the nipple will start discharging, and sometimes it can actually contain blood. This one, I know that everybody who has this one must run because it's really scary. And another one is that the nipple itself might change in appearance. It may become inverted. Inverted means instead of pointing towards it, it goes up or down. That is not the natural way it's supposed to be. So when such a thing occurs, you should get yourself checked out. Another one is that the size or the shape of the breast becomes distorted along the way. That's a very telltale sign that something is really wrong or something is going on here. Another one is also the skin of the nipple or the breast skin may have started to peel, scale or flake. It can happen like that. So that's when you know that I need to go get checked out. I need a doctor to see me to know what is really going on, so that if it's cancerous, we can start early to do something about it. Or if it is not cancerous, then you can be rest assured that nothing is going on.
So really, obviously, these are things that you need to look out for.
Yes, yes.
And you know, in Nigeria, so if you find something like a lump or some of these symptoms,
yes,
or some of these, you go. Do you go into your hospital or the nearest hospital, or are they specialist hospitals for this?
Well, if wherever you are, you can't get hold of a specialist, please feel free to walk into any other hospital. If they can't deal with it, they will refer you to the appropriate place to receive treatment.
Is there a charge? Is there a charge for it? Will they charge you?
Of course, of course. For you to see a doctor, you have to pay for consultation. I think basically that is it. But he can't charge you for any treatment he didn't give.
Right.
Yes. So.
And is it like they will take you through? What would they be doing? Would they be checking it, or would they be X-raying?
Yes. Well, first of all, any medical doctor that you go to with such a complaint will first of all examine the breast and then send you for further investigations, in which when the result comes out, if it's benign and it's something he can handle, even though he's not a specialist, an oncology specialist, he can handle it and then discharge you home. But if he knows that this is going to be cancerous or stuff, that you need to see a specialist, by all means, he will invite a specialist or refer you to one. Okay. That's what usually happens.
Because you hear some scary stories whereby somebody, especially in the UK, where somebody's gone for a test, they said it's not dangerous, and then suddenly they find out something new. So yes, that's why I say, are they specialists hospitals,
Yes.
or do you get a second opinion if you're not happy with the first one?
Yes, second opinion matters a whole lot. Second opinion matters a whole lot because, as a matter of fact, I have a colleague of mine who was diagnosed of, she had a breast lump. We took her to the theater. I was part of the team. We took her to the theater and got some tissue of the lump and sent it to the lab. The lab came back and said that she had cancer and they had it staged. But on coming back, the specialist that was called was like, they have already set up a date for mastectomy, that is removal of one breast. But she gave up on the doctor and said, please, let me buy more. Why don't I go for another? She's gotten a second opinion. She now said she wants a third opinion for them to confirm. And when they now went, they sent this sample they sent one to South Africa, another one to England. And when it came out, she didn't have anything.
Wow.
Yes.
So she would have cut both breasts off, or one breast off?
One.
And there was nothing wrong?
There was nothing wrong.
Wow.
So definitely in cases of lumps and cancers and stuff, second, third opinion, it is really, really important. But then some people will put pressure on you. No time to go and do tests, because if it's real cancer, the time you're waiting for your test, it can be spreading. Yeah. So the thing is, go for people who know what they are doing, tested and trusted, so that if it's cancer, they start working on it immediately. And if it's not, you go home. Yes. Now, we go into diagnosis of cancer, breast cancer. You have diagnostic tests and then procedures for breast cancer. And the method of diagnosis in breast cancer is, first of all, like I said earlier, breast examination. Then you do what we call mammogram, breast ultrasound, and then breast MRI scan. All these are imaging tests. You don't need to, it's not invasive, they're just images. And then the last one is biopsy. Biopsy means when you cut the person open and get a tissue and send it for histology. Another one, in breast examination, we have the clinical breast examination and the self-breast examination. Clinical means the one performed by doctors and nurses when you get to the hospital. Self-breast examination is the one you do yourself. Now, women who are in their 20s and 30s, they have, or they should have, clinical breast exam at least every 3 years. Now, that is what you were saying, that maybe a lump was found to be innocent, that is not cancerous, and then later it develops. That's why it should be regular. They should take it serious, especially if you have a family history of breast cancer. It should be a regular thing, so that by the time it tries to be malignant, it's caught. But if you leave it and, like I did 3 years ago, I'm no longer doing, anything can happen.
Okay. Wow.
Yes. Now, after the age of 40, women should have breast examination every year.
Every year?
Yes.
Wow.
It should be yearly.
Do they do that in Nigeria? Because I don't know whether it's common here.
Okay.
Yearly sounds like quite regular.
Yeah.
But is it common for Nigerians, especially Nigerian ladies, to check?
No, it's not. It's not. But because of subsequent awareness and everything, you see people walk into the hospital and tell you, I just need to check myself. I'm not sick. Nothing is wrong with me. I just need to have a check.
Now, when you say check, you're talking about a clinical check, not a self-test.
No, not
because you can check every day.
Yes.
If
it's a breast self exam, you can do it at home at your leisure time. But if for proper evaluation in the hospital, for women over 40 yearly, those in their 30s and 20s, it should be once every 3 years.
Right.
Yeah. So for the breast examination, the women, first of all, before you do this, you should look at the whole place. Is there any changes that you detect? You should be reported to a medical expert. And then this self-breast examination, you don't do it lying down. You do it standing or reclining in a chair. Reclining means when you sit, you relax and then you start. That is it. Now, next thing is, this is how it is done. Let's say that this is the breast. Then for women, you don't do the breast examination with hands open. You close it, palm together, then bring it and then go straight this point. Divide the breast into 3 parts. this edge, the middle, and then the other edge. That's how you do. And then you come back again, you go round and round, just in case you missed anyone, you go round and round. And at the end of it, you try and use like hands, your index finger and your thumb to squeeze the nipple to see if there's going to be a discharge. Is it, some people have milky discharge, but you're not breastfeeding. That is not a good sign. Or black discharge, or even bloody discharge. Whichever one you realize, go to a medical expert immediately. Then another one is mammogram. Mammogram is just an X-ray of the breast. There's nothing more, and it uses very little amount of radiation. So there's no fear that in my doing mammogram, it might even predispose me to getting breast cancer if I don't already have it. No, there's nothing like that. So in mammogram, we have the screening mammogram and then the diagnostic mammogram. That is the one that is people are encouraged to go for screenings. That doesn't mean you have it, but the one that will diagnose you whether you have or you don't have, you'll be sent there by a medical expert. You know that they are trying to find out something. Now, another type of diagnosis we talked about. The first diagnosis is what? Self-examination. Second one is mammogram. The third is breast ultrasound. Now, ultrasound uses sound waves to outline a body part, and then the sound wave echoes are picked up by the computer and then creates a picture. That's just how ultrasound works, and it is used to investigate areas of concern found by a mammogram. So the fourth one now is MRI. MRI just means magnetic resonance imaging. They use magnetic and radio waves instead of using sound waves, as in the case of ultrasound. And then MRI scans can take a long time. So it is used if it's not really used, but if views from your mammogram exam is not clear, then they will now send you for further checking with MRI. So the next one is still the biopsy. Yes. Now, if a patient has a lump that is present in the breast, the only way now, if you are very, very scared, you don't want to go through mammogram, and especially if this lump is painless. See, any breast lump that is located in the breast that pains you is even safer. It is very, very scary where a breast lump doesn't pain you, but it's there. You can feel it, it's there, but it has no pain. Usually cancer tissues appear that way.
So no pain?
Yes, no pain in cancer tissue.
Really?
Yes,
wow.
Most of them.
Okay.
Some of them that are painful might have been maybe infected. Yes, but usually cancer lumps are painless. Yes.
But you will have all these tests.
Yeah.
How is the general public going to know about all these tests, and which one is the best one for them?
For them.
Which one gives them the like a result that they can depend on, or are there any grades? So
Yeah.
why would you have one and another one?
Now, if you just want to screen yourself, there's nothing wrong with you. You're not seeing any lump. There's nothing. All the symptoms I described so far, you don't have it, but you just want to be sure. You just go for mammogram, and whatever they tell you, I mean, you take it. You don't have anything. But if you already have a lump in the breast, maybe it's painful or painless, whatever the case, that's when you go for all this. You get your mammogram first, and they tell you, oh, this one is okay. You go for that. Or something is found in the mammogram, but we're not sure. There's a mass definitely there, but we now want to know the type of mass there. So you go for that to do your MRI and all of that. And then for biopsy is that you go, there's a needle, we call needle biopsy. Just take it, extract tissue from the lump, and then send it to lab. They're now the ones that will say categorically clear whether there's cancer cells or not. Yes. So when they remove the mass is removed and then studied. That's all. So we move to factors that we consider during an examination. When an examination is done, we just want to find out if, in the case of breast cancer, what is the breast cancer grade? We grade them 1, 2, 3, 4. 1 being the mildest and the rest 4 or 5 that being very, very severe. And then you now look at the hormone receptor status, and then that is it. And then there's more technical ones we call HERS, which will be left for medical personnel to.
So these are examination factors. These are
What we look
what
out for.
doctors look for.
Yes.
So
that if you have cancer, it might not be the worst thing ever, because it can just be stage 1, which is still very manageable.
Right.
Yes. Stage 2 is not the end of the road, but it's when it's now progressed ahead that we now say it has disseminated, is now spreading through the system and going to the bones, organs like lungs and liver. That's when it's bad. So when we check you, we don't just check whether there's a cancer. Okay, fine, there's cancer. How widespread is it?
So what you're saying, when you hear the word cancer, the big C, it's not the end of the world.
No, it's not the end of the world.
So you can have cancer that is stage 1.
Yes.
And therefore it can be treatable.
It can be treatable,
okay,
and you have total remission.
Because usually when you hear cancer, you just, I'm sure, I haven't heard it before, but God forbid that. But you just think that's the end.
No, that's not the end.
Yeah.
That's not the end.
Okay, cool.
That's not the end. Even for the very last stage, it's still not the end. Now, tests to find where the cancer has spread. Now, when you are now confirmed of being a cancer patient, there are tests we run to find out what organs and where the cancer has been in the body. The first is chest X-ray. We look at the lungs. Is there any cancer cells that metastasize inside the lungs? The second one is bone scan. We scan all the bones usually, because it's coming, because this is the chest. The breasts are here. So finally, see these bones in the middle, sternum, that's what we call it. It's going to go there. It's going to go over here. It's going to go to the ribs. All of that is to go there. And then as it's going there, it's entering into the lungs, attacking the lungs. So that's the first thing we do is chest X-rays to know how affected your lung is. Then we do what we call CT scan, that is computed tomography, to see the chest and then the abdomen. What is going on there? Has it spread up to that place? Then we do MRI too for the brain and spinal cord. Of course, this is the brain and spinal cord is just here, so it can move anywhere. So we still need to check this. Okay, this cancer, it's bad, but has it gone to the brain? Has it gone to the spinal cord? Because I think those are the very, if it goes there, then it must be the very severe type. And then you now do ultrascan of maybe any other place, maybe kidneys and stuff, to check out the extent of spread. Now, treatment of breast cancer will depend on various factors. We don't have a particular treatment. This is it. We come and give you this particular drug, take. No, it is a personalized treatment in which we ask you. Now, we will find out what type of cancer it is, the stage and the grade of the cancer, and then we find out whether the cancer cells they are sensitive to hormones, and then the patient's overall health. Are you healthy before the cancer came, or has the cancer now eaten you to the extent that you're now emaciated? People would see. And then also the treatment depends on the age of the patient. How old are you? Young? Are you middle age? Are you elderly? All of that plays a role. And then the patient's own preference, because some people, you can tell them, okay, fine, this is what we found, and we want to cut off the breast. And they said, no, you need to respect the wish of the patient.
So, I mean, why is age a factor for treatment? Oh
yeah, age is a factor, because as we go along, we will see the side effects of each treatment. I try to bring out, the side effects.
So what you're saying is each treatment has, or some treatments have,
yes, like, okay, effects. Let me just go there. Like chemotherapy. Chemotherapy is the treatment for cancer. The cancer drugs, the chemo drugs are very, very strong, very, very potent. So first of all, when you introduce this to anybody, it goes and decreases the white blood cell count, which is what fights immunity in a human being. And then the elderly people, or the elderly population, already by age, their white blood cell counts are low.
Okay.
Now, if you add that, so you make them open to any infection. So you're treating this, and you're exposing them to that. So the main breast cancer treatments may include surgery, radiation therapy, Biological therapy, that is targeted drug therapy. If then hormone therapy and chemotherapy, like I said. Now, surgery. We have two types of surgeries we do for this. It is called, one is lumpectomy and the other one is mastectomy. Lumpectomy is going to the lump and remove it. Mastectomy is removing the whole of the breasts. And then we have the lymph node surgeries. Like I said yesterday, breast cancer spreads through the lymph nodes. We have three types of circulatory systems. We have the arterial, the venous, and the lymphatic drainage. Now, the lymphatic drainage is where these cancer cells goes, because the lymphatic drainage is in charge of removing excess fluid from the body. So in removing the excess fluid, the cancer cells also enters the drainage and then causes problem. And when it's there, so if the fact that you've taken away the breasts without taking away the lymph nodes, it can still come back. So what we do is that we take away the breast and take away the surrounding lymph nodes around the clavicle, up and down, and then around here, the axilla, and then around this place, the sternum bone, so that the person is safe and we know that it doesn't come back again. Now, another one is radiotherapy for breast cancer. Radiotherapy is basically like you do it in cycles. You have two, or you can do up to 3 to 5 sessions, and that's it. And the type of cancer we're talking about will determine whether this type of treatment will work. Now, the side effects of this radiotherapy is, one, swelling and heaviness of the breast. Yes, it can happen. Then sunburn-like changes. You know, when you go out in the sun and your skin is burnt, that's the kind of side effect that therapy can give you. And then anybody undergoing therapy, it is not unexpected for the person to be weak. They will always be weak. And then there's also damage to the nerves of the arm, so that the person can feel numb in the arm, pain, or even weakness of the shoulder, arm, and the hand. Those are the side effects of the therapy. And then there's also and the hand will be kind of increased in size, because the lymph drainage, if you remove the lymph drainage, you've removed the thing that takes excess water away, so that the hand will now be swollen due to the accumulation of excess water in.
Sounds quite painful.
Yes.
I mean, you're in pain already.
You're in pain already.
And
That's why
you need to go through a painful.
Oh yes. No, we usually give them very, very effective painkillers.
So
Yes.
but painkillers are temporary.
We keep giving because
Wow.
the pain
Wow.
is out of this world.
Wow.
I think cancer is the
Wow.
most painful disease. So when we are sounding the alarm, prevent, it's not a joke. Once you get it and it's confirmed, the treatment is not easy. The side effects of those treatments are not easy, and invariably the person dies of the same cancer. So the best thing is to prevent it.
So I like that word prevention, because
Yes.
that's really why Salad Master sponsors the show.
That's right.
Yeah, because of the prevention side.
Yes.
We need to, we need to look at the prevention a lot.
Yeah.
Because this information, I feel like I'm in pain myself right now. Just listening to it.
Yeah.
I can't imagine going through it. But listening to it.
It's a harrowing experience.
How do doctors prepare people to go through
For
this?
that.
Is there any
Yes.
psychological
Yes.
thing that you do?
First of all, every medical doctor must have. We take psychology very seriously.
Right.
So we will cancel on your own before you even get them to go to this psychologist and counselors and all the rest. And then before you even give them the results, it is advised to have a counselor in the room before you declare the results. And then again, you have them come with family members. Yes, because some people just break down from there. So they need to have people who are close to them, who came with them. And then you have to have a counselor immediately. After you declare the results, you'll be there, counsel, and then move over to a professional counselor.
Wow.
Yes.
So sounds like it takes a while before you actually get the treatment, because you've got the psychological stuff you need to do, the
and then
preparation.
the test is what takes a whole lot of time, because you need to be sure, because sometimes some results can be ambiguous. You don't know whether to cut or not to cut off because it's a sensitive area. And women, any woman that has a cupped breast, I mean, her self-esteem can never be the same again. So it's something you need to be careful of. You need to be careful that you're moving in for treatment, then that the tissue is already really afflicted with cancer. And because if the tissue already has cancer and you say no, there's no cancer, the woman's going to die. And if she doesn't have, and you cut off a tissue like that, you've invariably damaged her somehow. So is something you need to be careful. So the tests take the whole lot of time. It can even take over 3 months, 4, just to be sure that this is what we're dealing with.
But then you also said that time is important, because you might have the aggressive type of cancer.
Yes.
So if you're doing the test over 3 months, surely that can affect someone that actually has it.
Yes, that's why we advocate going for screenings.
Okay.
For those who are younger, do it every 3 years. Every three years, it must be cut. The best thing for it is catch it on time.
Right.
Yes, if you don't catch it on time, man, that's it, because it can spread like wildfire to vital organs.
So what we're saying is prevention.
Prevention.
Is the best, and then if you have any symptoms, you need to catch it quickly.
Quickly.
So
if you notice anything, move.
Okay.
Go to a doctor immediately.
Okay.
Yes. So the other one is chemotherapy for treatment of cancer. Now, chemotherapy or chemo is the use of cancer-killing drugs. That is basically what chemotherapy is, cancer-killing drugs. Now, it is usually given IV. It is given directly through the veins, or it can be taken as a pill or liquid in whatever form it comes in. Your doctor gives you, just take it. And then they enter the bloodstream and they reach most parts of the body. Now, they combat metastasis. Metastasis is spread. If it's in the breast, they keep it there. It doesn't let it spread to the lungs, the bones, and all of that. And then this drug also can damage some normal cells. Yes. In trying to fight the cancer cells, it can damage cells that are normal. Now,
so in combat, when you're fighting something, you are sacrificing something.
Yes.
Yeah.
Yes.
So you can't fight without sacrificing.
You can't. Wow. You can't. Wow. Chemo, cancer drugs that kill cancer, they're really potent.
So you could kill the cancer, and you could die for something else.
That's right.
Wow.
That's right. Especially if your health status was below optimal before the cancer started. Now, side effects of chemo, we have the side effects of chemo, first of all, will depend on the type of drug given, the amount given, and the duration or the length of treatment. Because chemo can be given in cycles. You can have 3 cycles. You can have 1 a week, come back maybe in another 2 months' time. The preparation is crazy. Now, the side effects of chemotherapy is what? We have a short-time effect and the long-time effect. First of all, what I used before I became a doctor, the only thing I knew from Hollywood of cancer is that whenever they say a patient has cancer, you see the person will have full hair. All of a sudden, the hair is gone. Even the movie directors understood the side effect of chemotherapy, So hair loss or alopecia, the hair really starts falling out. If you're combing your hair, it starts coming out. And really, it doesn't grow back until the head becomes bald.
Really?
Yes. Wow. That is one of the bad side effects. And some celebrities who have it, they wear wigs.
Yeah, I noticed that.
Yes, or tie scarf because the hair is all gone.
Wow.
Yes. Another one is that they cause loss of appetite, or it can increase their appetite depending on the type of drug you're given and how long you've been given it. And then another one is, yes, this one I noticed, every cancer patient I've seen, they always feel like vomiting, nausea. They can't hold anything down. That's the side effect of chemotherapy. And then there's higher risk of infection. Like I said before, they have low WBC levels, that's white blood cells. The chemotherapy decreases it, which means white blood cells are part of the normal cells that these drugs kill. Now, for the females, it stops menstrual periods. It does. And then there's early bruising or easy bruising whenever you do, or bleeding You can just sneeze your nose and blood starts coming out.
Mm.
Yes, it can happen. And then they get tired easily. Of course, the drug is the powerful one. So when it goes through your body, you'll be tired.
So it's affecting you in a
Yes.
big way. I mean, the hair loss is common, like you said, the hair loss.
Yes,
And
the hair loss. Most of chemotherapeutic drugs come with that. Hair
Are there
loss.
is there any weight loss?
Yes,
Weight
cancer.
loss? Yeah.
It's not just no. Now the weight loss is a cancer thing, not the drug side effects. Yes,
okay.
I'm just dealing with the side effects of the chemotherapy.
Right, okay.
But weight loss is a cancer. You can't come down with cancer for a long time and not lose weight. It's not possible.
But I must say I've learned something today because chemo.
Okay.
I actually didn't know it was a drug.
Okay.
I actually thought it was radiation combined with a number of things. But now you're telling me it's actually a drug.
Yes, it is a drug.
Wow.
It's a drug.
Yeah.
It is a drug. Okay, so now the long-term side effects of chemotherapy is menstrual changes, like I said before, infertility. Women who are on a chemotherapy for a long time, they can hardly conceive. And then another one is nerve damage. When the nerves are damaged, you feel pain, burning, and tingling and sensation. Then sensitivity to cold or hotness. That's all these are manifestations of nerve damage. Your nerves are damaged, and then it can also damage the heart. Now, that is all we have today for breast cancer.
The breast cancer, I mean, I know you said that because it's such a big topic,
Yeah.
that we're going to have another advanced program on breast cancer.
That's right.
We had a lot of inquiries about having more detail, more treatment, more prevention, and so on. So I think that's something that you're going to have another show for.
That's right.
And I think yesterday I said, remember, we have to keep it equal.
Yes, we have
a lot of the men were saying, well, we want to know about prostate cancer, isn't it?
Yeah.
But before we move on to prostate cancer, is it possible to just talk to Marvel to see if there's any questions at all?
Okay.
Yeah. So Marvel, are there any questions that you have? I'm in pain already because some of the things I've heard today has been, it's been terrible. But you know what? We need to learn. We need to know it because we need to start taking care of ourselves.
Yes.
We need to start treating ourselves.
That's
we need to start eating the right things.
Yeah.
We need to start knowing that if our parents have it, it's a possibility that you can also have it.
Yeah.
So therefore, you need to have regular checkups. There's a lot of good information there. No matter how painful it is, they say no pain, no gain.
Yes, that's right.
So you need to learn everything. Ladies out there, please, please, please listen carefully to what's been said over the last 2 shows. Take action, and the action you need to take is now. Check yourself. I'm saying check yourself. And also, if you find anything you're not used to, or it's lumpy or whatever, you need to go. Exactly. You need to go to the nearest hospital or doctor so you can get further examination.
That's right.
That's it. So Marvel, is there anything that you have, any questions you have?
Okay, wow. Dr. Dolly, I must say that it's been such an amazing session today. Lots of people are tuned on YouTube and also on Zoom.
Marvel.
Okay.
Just a quick one. Marvel.
Can you hear me? Yeah, go ahead.
You said it's an amazing session today. Yeah, we haven't finished. We still got one more topic to do. Just in case you're closing off us now. Remember you gave us some extra time. This is like a cup final. It's 1-1 at full time. Okay. And now we need another half an hour to finish off the game.
Right.
The winner.
Okay, just so that everyone is sure. Now, we have one quick question, Dr. Dolly, before you move on to the next topic. Someone is asking, does your food intake contribute to breast cancer? That's a very interesting one.
Does what?
Your food intake.
Food intake.
Contribute towards breast cancer.
Yes. There's been research done, and it's been found that people or women who don't have a family history of breast cancer but come down with it anyway, that they love food made with white flour.
White flour?
Yes.
White flour?
Yes.
That's flour for the international.
Exactly.
Flour for the...
Exactly. They love pizza, they love hot dogs, all of those eateries, bakeries, pastries, they love them. And me, personally, I've also tried to keep up with asking my patients. Whenever you have something related to breast cancer, I'll ask you, do you like pizza? Most of the time, the question is yes.
Okay.
Yes, I love pizza. One actually told me, I can't do without pizza. I'm like, what? He said, yes.
Wow.
So that confirms the research
Okay.
that was done in the US.
So that research is something that maybe we can send them.
Yes.
Yeah? Some
Yes.
links to. So
Yes.
Marvel, did you hear that, Marvel? Yeah. So to answer your question is probably not the only thing that contributes towards breast cancer.
Yes.
But it is something that has been researched into and found that most people,
most women who come down with breast cancer, they love food that has to do with white flour.
So white bread, white pizza,
all of that, cake.
Yeah, cake. Okay.
They can't do without finger foods, buns, all of that.
I love cake. I love cake. I love cake. Yeah.
Yeah, but of course,
okay.
Salam has that. They are healthier ways.
Yeah. Okay. Fantastic. That's the last question before you go, Dr. Dolly, to the next topic. Someone is asking, what role does exercise actually have on actually preventing or fighting breast cancer? Does exercise help in any way?
Yes, exercise does help in fighting breast cancer, like every other lifestyle disease. But in case of breast cancer, care should be taken when they are doing the exercise, especially something like contact sports with women. If anything hard hits on the breast, it forms a lump too that can be mistaken for cancer. So if those kind of contact sports that women do, there should be shields for women, protective devices that women can use to protect themselves. But definitely exercise helps in prevention of breast cancer.
But if the ball, like let's say the ball hits the breast,
yes,
and it creates a lump, or let's say
yes,
create a lump, but that lump is not a cancer lump, is it? It's just a lump.
Yes, it's just a lump.
So you just want to avoid signs of lumps. That's all. Not
yes,
avoid
because
cancer.
we don't know by just looking which one is cancerous and which one is not.
Okay.
And even if you have that kind of fibrous lump that is not cancerous, you still go through the harrowing experiences of some of these investigations I talked about, and diagnose.
Okay, no further questions for now. I'll just hand it back to you guys in the studio. Over to you now.
Wow. Thank you very much, Marvel. Thank you very much. Dr. Dolly, over to you. The next program, the next part is a part that we've all been looking forward to as men, because we want to protect ourselves also.
Okay. Yeah? So now we're now into prostate cancer. Now, prostate cancer, as expected, we are not going to spend more time on it. Why? Because it is said that with prostate cancer, more men die with it than of it. I don't know whether you get what I mean.
I don't get it. Die with it.
They die with it than of it.
Than of it.
Which means that most men who have prostate cancer usually die of another cause other than the prostate cancer killing them.
Right.
Yes. They might have it, but usually it's not the cause of their death.
Right. So you mean they can live with it?
They can live with it.
Is it like, for example,
unlike
let me
breast
give,
cancer.
Let me give you for example.
Okay.
Is it like you can be diabetic? Yeah?
Yes.
And you can live diabetic. But sometimes diabetes is linked to probably organ failures and things like that.
No. Okay. Prostate cancer isn't like diabetes because unless it spreads, it can't touch other vital organs.
Right.
If it's contained in that place, yes, it cannot really cause much damage. So it is said that 80% of men that are discovered to have prostate cancer at autopsy, that's after they died.
80%?
80.
Is this 80% of the men that die?
No.
What's that?
80% of men that have prostate cancer are said to be discovered at autopsy after death.
Right.
Which means it didn't cause the death, but it was discovered that they had it.
Okay.
Prostate cancer can be likened to fibroid in women. Right. It's not every woman that has a fibroid that has symptoms for it. Right. No, but it's just there. The only ones that come to the hospital for treatment are those ones that become symptomatic.
Right.
Good. And 16% of men are now diagnosed during their lifetime. It's only 16% of men that have symptoms that disturb them from prostate. So that the ones that come to the hospital are the ones that seek for care.
So am I right in saying this then?
Okay.
Yeah. The reason why we have these stats
Yeah.
is because men don't go for checkups. Because if they went for checkups,
Okay.
yeah, then they will find out before they die.
Okay.
Or before they die with it, or what you say.
Yes.
So whereas I think more men don't. I think you find men don't go to doctors as much as women go to doctors.
Yes, that's right.
So could that be if more men went for checkups, then that stats of 80%,
Yeah.
are found after they die that they have it,
Yeah.
would go down.
Yes, it will. Definitely, it will. But with prostate cancer, if you become symptomatic, I mean, you can't just go to a doctor if you feel you're okay. Most of the men who die with it, they don't have anything to complain about.
No, but if they go for regular checkups,
Yes.
because I don't know many men
Yeah.
that go for checkups every year. I know men
rare.
that go for checkup when they're feeling ill.
Mm-hmm.
Yeah.
Yeah.
And that's usually too late.
Too late. Too late.
Yeah. So I feel that there's some truth in the fact that the reason why the stats are high in terms of people who found out they have it after they die is because they're not checking while they're alive.
That's right. That's right. They didn't go to the hospital, and they didn't, and especially in our part of the world.
Oh yeah, Nigeria.
If things happen like that, sometimes they will think, okay, I went and I had beer with my group of friends, and suddenly I came home, I can't pee. They must have put something in my drink.
Okay.
And instead of them coming to the hospital, they are going through some other means to take care of it. But at the end of the day, it's just that prostate can decide to give its symptom anytime. So it doesn't matter what you drank or who you were with. It might not be a case of poisoning. So it can just be a case of either the negligence, like you said, on their path. They are not going for regular checks. Another one can be misdiagnosis. Instead of you to treat prostate cancer, you're treating poisoning. Yes, it can just be that. And then 3% will die of it. So of all the 16% of patients with prostate cancer, only 3% will die of prostate. So it's really not a health burden to say. But in as much as that 3%, we don't want to lose them. That's why Salad Masters is here. That's why this program, Your $1 Billion Body, it's here. Yes. We don't want to lose the 3%. So the risk factors for prostate cancer are, first of all, age. What is the age that the man can get to before he starts bothering about prostate cancer? It is said to be 60 years. Another one is family history. How was your granddad? Did he have any history or similar complaints? How was your dad, your uncles, brothers, and cousins, male cousins? Is there any family history of prostate in any way? It should be noted. If you have, then you're in danger of getting it, and you should seek for help. And don't do like men, don't go for regular checks. This is now an avenue for you to regularly check yourself because there's a family history. And then as the person gets older, 50 is not there, just 60, from 60 down, you can go for check in the hospital so that you can catch it if ever it comes. Now, another one is hormones. Some kind of hormonal drugs that men can take can predispose you to that, like athletes, wrestlers who want to pump up their muscles, and you take stuff.
Okay.
Yes, it can predispose you to that. And then another one is race. It occurs more in black men.
Really?
Yes, it occurs more in black.
So it's kind of like the opposite to breast cancer, because you said breast cancer.
Yes, breast
is more
cancer in white women.
Caucasian.
Yes.
Yeah. And then now you're saying prostate cancer is
more in black men.
Wow.
Yes.
Is there a reason for that?
Well, the reason we haven't found it yet.
Okay.
We haven't found it yet. But some reason which hasn't been authenticated is that African men have more children. I don't know whether the more children you have, the more you. It's not been proven anyway. But because that's the only major difference between the two races.
Well, the weather is also different, isn't it?
Yes,
Yeah.
weather.
I'm just saying,
I
it's
don't
not
know about
scientific yet.
that.
We have.
Exactly. And then another one is dietary factors.
Mm.
For men who love to eat fat, the fatty kind of meat. I have some male, they won't have any meat unless there's fat dripping oil down it. They love those kind of meat. And then I think the Igbo tradition too plays a part. For those people who are from the eastern part of Nigeria, they know, they say it, that the meat you keep for the head of the family should be, dripping of fat, sumptuous, those kind of things, this is how cultural trappings can endanger our health.
So also, like you said, there's also a difference in terms of our diets.
Yes.
In
Yes,
terms
that's
so
right.
that's another thing.
That's
Apart from the
another thing.
weather, apart
Yes.
from the number of children
There's
on
diet.
average, there's also the diet.
Yes,
Because
there's also
the diet in each you can say in each side of Nigeria is common.
It's common.
Do
Yeah,
you understand?
it's
So
common.
I don't know, I'm just thinking.
It's
out of the
true.
box,
It's true. It's very true. Diet plays a role.
And that's why we Salad Master actually on the YouTube channel. If you're on the YouTube channel, like and subscribe. But that's why in Salad Master YouTube channel we have foods from different parts of Nigeria: the east,
That is it.
the west,
And
the south, and
yes.
the north. Yeah.
So the thing is, everybody should have a mixed menu. Take the best from each side and give yourself a treat.
Right.
Yes. So it shouldn't be, oh, my people don't eat this, I'm not going to eat it. It might be healthy for you. Who knows whether you will need it. So go ahead and get it. Another one is cadmium exposure. There are chemicals. When you go buy stuff like all this processed food, it is advised you read the labels. Read the labels. Some foods are deliberately impregnated with multivitamins. If you are using multivitamins too much, it can also predispose a man to have prostate cancer. Yes. So, because what we call vitamins and minerals are what we need in trace amounts. They are not really, you need to have it, but not in excess. When you give it to the body in excess, that's a problem you're causing. Yes. And then another one is dioxin exposure. Like I said, read labels, all those ones. Cadmium, dioxin. Please look, there's several things that have it, even things as harmless as toothpaste. Check. Yes, check. Liquid soap you put in your wash machine that doesn't directly enter your mouth, but through contact with clothes and all of that can enter into your body. You need to check. You need to check.
So you say dioxin?
Yes, dioxin.
Okay.
Yes.
So it can be on clothes. What form is it on clothes?
Well, it can be maybe like starch sprays and stuff. Yes, it
okay.
can just.
Okay.
It can just be on clothes. So we are advised to be really cautious when you want to buy things off a mall from this thing. Just look at it, read, take your time, read it. Some people look at you when I go shopping, I spend a whole lot of time trying to read what they have in the label. People will look at you, oh, why are you spending so much time? What are you trying to say? Are you trying to say, no, but you know what you're doing, because at the end of the day, it's your health. And when you are sick or anything, those people are not even going to be there. Now, first of all, before we progress, we need to know what is prostrate. Where is it in the body? Where is it located? Fine. We have the prostrate. It's like it's a size of a walnut. For those of you who know what a walnut is, it's that small, but it's very, very important in the body. It's seen around the pelvic region of a male, not a female. This organ is only contained in a male, and it has a job, two jobs. First of all, it produces the seminal fluid in which the semen and the sperm travel. And another thing, it forms a liquid medium in which the sperm moves. So the organ that produces this seminal fluid, it is called the prostate. And this prostate, you see it in front of the bladder. Bladder is the storage organ for your urine. It is seen, the bladder is on top of it. The pubic bone is in front of it, and then rectum is the storage place for when you want to poo. That is the storage. So this is the three organs that are closely related to the prostate. And the prostate, you can't see it, you can't even feel it. The only way you can feel the prostate is going through the rectum behind. Like when you go to hospital for check, regular screening, that's how the doctor goes. And some people are very uncomfortable. They don't want that kind of examination. But then if you're in danger of developing it, you need to be screened. So the only way you get to the prostate from outside is through the rectum. They will now check and see, is this the normal size? This is about this size, walnut kind of size. And it's all about, it plays a role in reproduction, like I say, transportation of sperm, and then also providing the lipid medium in which it travels.
So does it mean if you have prostate cancer, it could affect you in terms of fertility, in terms of your how fertile or
Yes.
your sperm count?
Oh yes.
Yeah?
No, it's not. It doesn't affect the sperm count, but it affects the transportation.
That's what I mean.
Yes.
So
The count might be normal,
yeah,
but it's trapped.
right.
The whole sperm is trapped. It can't come out because the
Right.
prostate is enlarged.
Yeah. So it's preventing that.
Preventing, yes. It's kind of blocking.
So basically, it can stop you from going to the toilet.
Yes, it can.
Wow. Okay.
It can. So
Yeah.
the thing about it is, the thing about prostate cancer is that it has early warning signs. When it comes, you can't stay at home. That men don't like going to the hospital is not when your prostate starts giving you symptoms. They run to hospitals. Yes, they run. So most of the people who has prostate, it doesn't give them trouble, and eventually it might never give them problem. But if there's a family history of it, then you know that you need to do something. So early warning signs of prostate cancer: number one, either there's a burning or pain during urination. You can't stay. The pain is not something you can manage at home. It's burning, severely burning, or severe pain when you're urinating. You know that this is not normal. Something is going on and something needs to be done. Another one is difficulty in urinating. You try to, you feel pressed, you go to the loo, nothing comes out. You are putting pressure, nothing comes. Or when you start the urination, it will start, but there's trouble starting. Or when you've started urinating, you can't stop. You keep dripping, keep peeing. That is another symptom of prostate. Another one is more frequent. People, when you go to bed, you have, maybe some people do like go to washroom and have a pee, maybe like 2 or 3 times in the night. But with prostate, you know that something is wrong. You can pee up to 10, 12 times.
Oh, wow.
In a night.
Wow.
You know that no, this is not that
So normal.
I drank too much water. No, there's something going on. Another one is more frequent urges to urinate at night. Yes, I said that. And then loss of bladder control. You can't control your bladder. You can just be in anywhere.
Okay.
You can be in a wedding party, you can be on a bus, you can be in a car, you can be in a plane. It doesn't matter that you just came from the loo. You still want to go again. Sometimes you embarrass yourself because you'll be walking down the aisle. People are like, what is wrong with this man? You keep going. You keep going. That's a sign of prostate. So when such a thing happens, some people might mistake it initially for diabetes, but then if you go to hospital, it will be singled out.
Okay.
Another one is when you pee now, there is decreased flow or velocity of urine stream. You're peeing and putting pressure, but it's coming in dribbles. You know that something is not right. Another one is when you see blood in urine. That's a sign for you to just start running. Something is definitely wrong. Definitely. Unless the person had a fall. Yes, if there's no trauma, all of a sudden you see blood in the urine, there's a problem. Or there's blood in semen. That is another way it can come. And then I want to focus here on the dietary cause or dietary risk factors for prostate cancer. Number one is red meat. Like I said, red meat. I've talked about fatty meats, different. This one is red meat. Red meat and processed meats. Like you can have anybody who eats, their diet is high on beef, lamb, pork, all of that. They will heap it. Daddy likes meat. And they will put in, you are 50s, they are still putting for you 60 years, you like meat. I like in my own place, Igbo men love meat.
Wow.
Everybody knows that, yes.
Oh yeah, meat.
Igbo men love meat. And they don't do chicken. They really don't like chicken. It's meat, beef. When they have village things and they share, they can bring cow and they will share it according to families. They go to the village square and see, in our tradition, it doesn't matter how rich you are. If it is felt a very big slight if such meat is shared and you didn't give them. Some of them, their mothers keep for them even when they are overseas, to tell you how important meat is. Yes, their mothers will keep it and they'll put it in above the fire, and the meat will keep on being there. It can be there for a year and it's good, and when you come out, they'll cook it for you. It is that serious.
Oh.
So men like that, that is a very high risk of
So red meat.
red meat or processed meat, maybe like sausages, ham,
Okay.
all of that. Oh, they are also a cause. Another one is dairy products, milk, especially full cream milk, cheese, all of that. It can give you, it can predispose you to prostate. It's not that it can cause, but check your diet. Those people who have been diagnosed with prostate cancer, if you just start asking them, excuse me, sir, how is your diet? Do you like meat? You would be getting the answers. Yes, I love meat. What about milk? I don't miss it. It will be falling in place. You know that, okay, so this is actually real. It's a real risk factor. Another one is also alcohol. For men who love beer, for men who love alcoholic drinks, like I've always said on this program, alcohol is nice when it's taken in moderation. But if you try to take it in excess or if you try to abuse it, there are a whole range of things that excessive alcohol can give you. And prostate is one of them. Yes, prostate is one. Another one is saturated fats. Saturated fats. Any fats like vegetable oil, like the one we have here on our banner, vegetable oil, butter, margarine, all of that. Those are saturated fats. And when you have them in your system, it also predisposes you to prostate cancer. So that is.
So what you're saying really is that these things we need to avoid.
Yes.
Yeah, or have in moderation. Have in moderation.
The best thing is moderation in everything.
Yeah.
Yes.
So it's moderation.
Moderation.
Because you can't tell, like you said, you can't tell a man that loves meat that you can no longer have meat anymore.
No.
Yeah? And a lot of these things that you say with regards to prostate cancer links
Yes.
to prostate cancer.
Yes.
They're not necessarily causes, they're just linked.
They're just linked,
For a lot of men that don't have prostate cancer, eat those things too. And drink a lot too.
Yeah.
So it's very hard to now say to people not, but I think moderation, I think that's the key.
Yes.
Because a lot of these like red meats and so on, they've all been linked to other diseases.
Yes.
And that's probably a build up of things.
Exactly.
So I think we just got to be cautious, especially in Nigeria. We need to say to the men, you can still have a little bit, but not too much.
Not too much.
And not too fatty.
Yes, not too fatty.
And that is the reason why Salad Master is here for you.
That's
right. So that they can make that meat less fatty. Yes. And you can start enjoying the meat with less fat. And taking out that oil, and using it for the right thing. So really, it's about it's about what we see today.
Lifestyle,
It's about-
lifestyle
it's
change.
about lifestyle. It's
Yes.
about eating right. It's about preparing your food right.
That's
And this
right.
is what the show is about. Your $1 billion way.
That is
So
it.
is there a few things you want to? You said you wanted to finish off on something.
Yeah. So my last topic on this should be on prevention. Like Mr. Tony just summarized, it doesn't. It's not anything other than that. Just everything in moderation. Alcohol in moderation. Red meat in moderation. Fatty meat in moderation. Dairy milk products in moderation. Anybody who's above up to 60, it should be, if you need to have milk, it should be skimmed milk, not full cream. Then exercise, it helps. Then run away from, then invest in your health. At 60, I mean, you've walked, you've achieved all you need to achieve. The only thing is sit back and relax. So invest in your health. Get cooking utensils like salad masters, cooking utensils that can make your living much more better and less unhealthy.
But you know, there's another thing, because some people like milk, and a lot of people don't realize you don't have to get milk from the cow or from the goat.
Oh yeah.
So really, the plant-based milks,
Yes.
like
Almond milk.
you know, almond milk is quite popular. So if you
Yes.
like your milk, you can get almonds. And
Coconut milk.
Yeah, coconut milk. Yeah.
Soybean
Yeah.
milk.
Soybean milk, there's some people saying there's something too much in there, but I'm just saying for the plant-based people,
Yes.
you know, they prefer almond milk, coconut
Yes,
milk.
almond is
You know,
the
so,
best.
so really, it's not all doom and gloom.
Yes.
You can still have your milk. You can still have your milk.
Sourced
but-
from the plants.
Exactly, not from the animal.
Yes.
Because what it is what we're doing is we're eating the meat from the animal. We're drinking the milk from the animal. So we're becoming, no, I don't want to say we're becoming animals, but
No.
we, you know, we're suffering something. And what a lot of things happen, what things that people don't realize is some of these animals are being injected with so many things
That's right.
to make them grow faster.
That's
I
right.
remember when a chicken took a long time to grow. But now I
Yes.
hear a chicken can be grown in one day.
That's
You
right.
know? I mean, how is that possible? I remember, you know, coming to Nigeria when I was young, and the chicken was this small and it would be that small for that long.
Yeah.
Now you see the chicken that small, the next day
it's
is that
all
big,
big.
and next minute is in the market. But
That's
if you think about the desire for meat in Nigeria, especially,
Mhm.
and in Africa, especially,
Mhm.
how do they cope? They must be doing something to fast track the growth of
That's
some of these
right.
animals.
So that they can meet the demand.
And guess what? We eat that. So whatever goes into that animal
goes into
goes
the
onto
person-
us.
into
So-
the eater.
Exactly. So that's the key thing. So really, what we're saying here, and you know, you said about moderation.
Yes.
Like you said, moderation in terms of meat and so on.
Yeah.
But you know what? If you are brave, and you said in the Igbo side,
Yes.
if you are brave, come off meat. Yeah, if you are brave, because guess what? That's gonna make you even more healthy. Am I right?
Yeah.
Yeah. And then you can find replacement for protein, isn't it?
Yes, you
And
can.
replacement for all these things that you think you're
Or
getting
you can
from meat.
do white meats like chicken, turkey,
Yeah.
snail,
Yeah.
seafood,
Right.
and all of that.
Exactly.
There's
So
a whole lot of other substitutes.
and guess what? Another thing I'll say, you say, you know, you got me worried. You said when you're 60, you should just retire and you've done everything in your life. Listen, I'm approaching 60 and I don't feel like retiring right now. You know, I don't feel like
Like
hanging up my
chilling.
slippers. Look, you know what? I saw a lady that was 105
Oh yes,
and
I
she's
saw.
running 100 meters.
Yeah.
So if you're 60, you're just beginning life.
Yeah.
Yeah, provided you've taken care of this body.
Mhm.
Yeah, and that's one of the things that we don't realize. You know, what you do between the age of 0 to 60
It matters a lot.
matters a lot.
Yeah.
So what we've got to do is repair some of the damage we've been doing.
Yeah.
And then I would say, look, if you're not brave enough to eat just vegetables and just, I'm not brave enough to eat just vegetables because I'm telling you, I'm not brave enough because, you know, I need to have that chicken, have that meat. But you know what? I just reduced the quantity on my plate.
That's
You
right.
know, if you're not brave enough, just make sure you're eating more vegetables and more fruit.
That's right.
Yeah, just increase your intake of
That's right.
vegetables and fruit. And by increasing your intake of vegetables and fruit, then guess what? You can avoid or
Reduce
prevent
your risk.
and reduce. I like that one. The
Yes.
word reduce your
The
risk of the cancers, the breast cancer,
The
the-
hypertension, the diabetes,
it's all
the
about
high
increasing this
cholesterol.
and reducing a lot of that stuff.
That's
yeah?
right.
And guess what? Salad Masters here to help you, because guess what? We have here our Salad Master machine.
Yeah.
And guess what Salad Master is doing to help you? They're giving 100 of these away in the next 30 days.
Yes.
So can you call the person that invited you onto this show, or if it's you just stumbled across the show, just see if you can send us a message and see how you can get one of these free. Obviously, you have to do something to get it free, but it's free. Yeah. So I want to say, Marvel, should we say Marvel? Ask Marvel. Marvel, do you have any questions for us before we wrap up?
Yeah.
Okay. Hello. I don't know, for some reason, my video probably is not coming up. Just trying to bring it up. But we just have one question. If you can probably hear me, someone is asking about prostate cancer. Dr. Dolly, they're asking, what exercises would you recommend for someone probably who has already got the condition? And what's the chance that they can improve? Is it a death sentence? Someone is asking. Is it final once you have it? And what exercises would you recommend? Yeah, thank you.
Okay, fine. I'll go straight to the one that says, is it a death sentence to have prostate? No. At the beginning of this introducing prostate cancer, I said that more men live in fact, let me just quote the stat. 80% of men have their prostate cancer discovered at autopsy. That is after they've died. Only 16% develop prostate cancer and have symptoms that will take them to the hospital for it. Now, out of that 16%, only another 3% die of it. So, prostate cancer is no death sentence. Of course, something can always be done about it. But before it becomes a full-blown cancer, it is advised for if people who know that they have a family history of it, or you know, and you're truthful to yourself, so you know that I've been abusing alcohol for a long time, or I am guilty of high diet in red and processed meats, together with dairy products and saturated fats. And then you are in the age range 60 and below, then you should know that you need to avoid these things to cut it out. But if it's in the family history and there are some things you've done in the past, obviously you can't redo, go for regular screenings. Let your doctor know. Now, instead of doing it once a year, you can do it twice a year, just to make sure it is caught. And then when the cancer is there full blown, then go to your doctor. By all means, they know what to do, depending on the stage and the grade of the cancer. They know what to do to get it there. And then for exercise, for someone in that age bracket, just like 30 minutes walk every day, 7 days a week, it's okay. Yeah.
Okay, powerful. I have one more question. Someone is asking, do you recommend surgeries for an enlarged prostate?
Yeah, enlarged prostates can be two things. We have what we call benign prostatic hypertrophy. If the prostate is just hypertrophied, that is, it is larger than normal, drugs can be used to reduce it. But if it's prostate cancer, one of the treatments of prostate cancer is what we call open prostatectomy. So you need to get into the theater and surgically extract the tissue.
Okay, I think, Dr. Dolly, you've actually given precise answers so far. So we don't have any further questions at the moment. I'll just hand it back to you so you can wrap up. Thank you very much, Dr. Dolly and Mr. Dolly. Over to you guys now.
Okay.
Beautiful.
Okay, so this is it for we've come to the end of the program. We thank you so much for staying with us till this time, and we hope you got a thing or two from this program. And then if you know, or you happen to be someone who's in the risk bracket that we've mentioned, all hope is not lost for you. You need to be proactive about your health, visit your doctor regularly, do your screens, and in case there is anything happening, all hope is not lost. If we catch it early, it can be dealt with and you'll be back to your normal health like it never happened.
Wow, thank you. Thank you. All I like to say is that, look, guys, thank you very much, Dr. Dolly, for the show. Thank you very much for your show, your $1 billion body.
That's right.
Sponsored by Salad Master. We'd like to thank the audience, the viewers, for tuning into the show. We'd like to thank those of you that invited other people into the show. And you know, Dr. Dolly, some people actually invite people around to their home to watch it also.
Wow.
So they actually watch it around the TV or around the screen. So we'd like to thank you all the guests on the show. So for us here, we're finishing off now. And remember one thing, the Salad Master machine is here. For anyone that wants a Salad Master machine, we have 100 of these that we're giving away free. All you got to do is send us a message and see if you can see a virtual presentation. So you can see a virtual health and nutrition presentation. We also have our cook school, Dr. Dolly, tomorrow.
Yes,
yeah, that's at 8:30 a.m. So those of you that want to see more on how Salad Master can help you make that red meat a little less red, yeah, and make that red meat a little more healthy, and show you how to reduce the red meat and reduce the fats in it and eliminate the meat, so you can be eating more plant-based stuff, so that therefore you can be healthier. Please tune in tomorrow to our cook school at 8:30 a.m. Even if you're asleep, just leave one eye open and one eye closed. By the time you get to a few minutes, you'll have both eyes open, because you'll be shocked to see what this healthy cooking system, Salad Master, and this Salad Master machine can do while you're one eye open, and then you'll find two eyes will open. Yeah. So guys, thank you very much, Dr. Dolly. Thank you very much again. And remember, all is not lost when they say you have breast cancer or prostate cancer. But remember what Dr. Dolly said, prevention is better than cure. So we need to prevent the stuff by eating the right food and preparing the right food in the right way. And that's why Salad Master sponsors the show. Yeah. And then remember another thing, you eat things in moderation. That's moderation, especially the stuff that are linked to cancer. So really, that is the main message I get from today. And remember, treatment, when you find something, go and get some go and get some help to see how, whether early. So that's us reporting from Salad Master offices. Thank you, Salad Master, reporting from Victoria Island, Lagos, Nigeria. And we're looking forward to seeing you on the next show. We'll be sending out the topic for the next show, so look out for the next show. Anybody that has any more questions for Dr. Dolly, you might be watching this after, and you might say, you know, I had some questions, but I wasn't watching it live. Please send us a message, and we'll get that message over to Dr. Dolly. So really, that's us reporting. I want you all to have a good night and a good weekend. And remember, if you like what you see, if you're on YouTube, then like, subscribe, share, and comment. Remember what I said? Like, subscribe, share, and comment. And then share it with at least 5 people so that we can have more people on the show. So guys, that's me reporting from Victoria Island, Lagos, in Salad Master head office. And over to you. And this is Dr. Dolly. So thank you very much. Thank you very much. Good night. Bye. Have a nice weekend. Bye. See you tomorrow, 8:30. 8:30. Thank you very much.